Hey people, it's your nurse Gladys at the Nurse to Follow, and thanks for joining us again. If you're new to this channel, you're welcome. Please do not forget to hit on that subscribe button and on the notification bell, and of course drop a comment down below. So guys, today, like I said in my previous video, today we shall be talking about some basic tips you need to approach NCLEX base exams, some basic test taking tips, just basic. And of course, you never know how far that can help you, so you want to stay tuned. Before we get started, guys, I want you to have this at the back of your mind. Always remember these key points I'm about to share. First, always remember that the NCLEX exam is designed to determine how you would respond in typical real-life clinical situations, and not just about you being able to recall facts learned from school. So their goal is to see how well you respond if it were a typical real-life clinical situation. Another thing I want you to have at the back of your mind is that NCLEX questions are usually based on four main categories of client needs, and these include safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. So these are the four main categories of client needs that most NCLEX questions are usually based on. Lastly, always remember this that you have the ability to pass any exam. Okay, you have the ability to pass any exam, and that the NCLEX exam is just one of them. Yep, we can now begin. When you see a question, when you first see a question, okay, imagine you're in the NCLEX room already and you're about to begin your exam. The first question that pops up, you read it the first time. You have to read it the first time. The first time you're reading that question, you're trying to get a general clue of what that question is asking of you. So take note, you're reading the first time just to have a general clue. That way you know if it's asking for a positive response or for a negative response. Secondly, you want to read the second time. The second time you're reading a question is to get an understanding of that question or to interpret the question. This is where you need to concentrate, okay? You need maximum concentration at this point to be able to understand the question. Let's say the question is difficult. You've read the first time, you read the second time, and it seems a little difficult for you to understand. Try to reword the question. Put the question in your own words and then try to, assess it again. Try to understand it again while in your own words. I think it's going to better your understanding of the question. Now, before you look down at the options, try to get an answer first in your mind. So always try to provide an answer first in your mind before looking at the options below. That way it maximizes your chances of making the right choice. And this comes with practice, guys. Let's say you're already preparing to take your NCLEX anytime soon. Now is the time to start practicing that while reviewing your practice questions, maybe with Saunders, or you will try this technique. Another key tip you should know: never leave any NCLEX question unanswered. For any exams you take, let's even put NCLEX aside. Let's put NCLEX aside. Any exam, never leave any question unanswered. Now, since we're talking about NCLEX, if you come across a question that is very difficult to understand, does it mean you should spend so much time on that question? No. Does it mean you should skip it? No. So this is where guessing comes in. You have to guess, but if you have to guess, be logical about your guessing. Guess logically, okay? So if you've read this question the first time, you read the second time and you still do not understand, but trust me, you will hardly be completely blank on a question. You have some ideas at least. Look at the options, eliminate what you think is wrong, and whatever you suspect is right, though you're guessing, stick to it. Okay, stick to it, and always remember, guess logically, guess and reason through it a little. Do not waste so much time on the question you do not understand. Another key tip you should know: do not change your answers. Once you've chosen an option, try not to change it unless you misread a part of the question. That way, okay, you can then change your option if you misinterpreted the question and you realize it right in time. Otherwise, avoid changing your options. Try not to doubt your options too much. Trust your own judgment. Lastly, like I mentioned earlier, you need maximum concentration. You need maximum concentration. Do not let anxiety control your thoughts. If you didn't watch my previous video, I advise you go check out the link. I talked a lot on ways to avoid these pressures from building to the level where you can't control it anymore, because it's the buildup of all these pressures that result to that level of uncontrolled exam anxiety. So you don't want to let your exam anxiety affect your critical thinking. At the beginning of the exam, you definitely feel a little anxious, but as you start seeing familiar questions, it's going to normalize. Things are going to normalize. Things are definitely going to normalize. Do not panic, because once you start to panic, once you start to feel very tense, it's going to affect your critical thinking, and that will of course affect your decision making on the choices, on your options. You won't choose the right options. You won't interpret your questions correctly. So you need maximum concentration to be able to select the correct answers. One last point: questions are most often straight to the point, simple and straightforward. Most NCLEX questions are simple and straightforward, especially NCLEX PN. RN can be, can get a little complicated, but most of the questions, whether LPN or RN, are simple and straightforward. One thing students always try to do, even with normal class exam, they try to overthink questions. They try to make questions appear difficult even when they are simple. You don't want to believe that, oh, this question can be this simple. Do not complicate the question. Answer it as simple and as straightforward as it is. If you're preparing to take your NCLEX exam anytime soon, I wish you all the best. I hope that this little exam taking skills are going to help you in one way or the other and contribute towards your passing, towards your success. Wish you all the best, guys, and see you in my next video. Please do not forget to check out my previous video if you haven't watched that yet, and stay blessed, stay safe.